Hello. Good evening, everyone, and welcome to today's Shine webinar. I'm Dr. Darwish Mohammed. I serve as the Treasurer and Head of External Affairs of Morocco SIM. And on behalf of Morocco SIM, it is my great pleasure to welcome you and introduce you all to our distinguished speaker for this evening, Dr. Marvin Jansen. Before we begin, I would like to reflect on the title of today's webinar, Ubuntu in Africa Simulation Network. Ubuntu in Africa. Ubuntu is a profound African philosophy, often expressed through the phrase, I am because we are. It embodies the values of humanity, interconnectedness, collaboration, and shared purpose. Principles that resonate deeply with healthcare simulation, where learning, teamwork, and collective growth are at the heart of improving patient care. Dr. Jansen is the head of the Clinical Skills Center at the University of Cape Town and the founder and current president of the African Simulation Network. He holds a PhD in health science education, specializing in healthcare simulation pedagogy, as well as a master's degree in emergency medicine, patient safety, and medical decision making. He also brings extensive frontline experience as an emergency medicine technician and paramedic. In addition to his academic accomplishment, Dr. Jansen completed the Professional Leadership Development Program at Harvard Business School, reflecting his commitment to advancing leadership in healthcare education. An award-winning educator and passionate advocate for socially responsive health professional education, he received the Emerging Leader Award at the South Africa Health Excellence Awards and was recognized as one of Mason Guardian's 200 young South Africans. Through his leadership and vision, Dr. Jansen continues to advance simulation-based education, strengthen clinical competencies, and promote patient safety across Africa and beyond. This evening, he will share his perspective on how the spirit of Ubuntu, I am because we are, can strengthen the collaboration and shape the future of the African Simulation Network. Without further ado, please join me in giving a very warm virtual welcome to Dr. Marvin Jansen. Marvin, the floor is yours.
Good afternoon, good morning, depending on where you're watching from. Thank you for that introduction. It's always lovely to see you and to see the audience. This is really it's a really honor for me to spend some time with you this evening and just have a discussion around Ubuntu and why I believe that Ubuntu is such a powerful lens through which to view simulation and healthcare, and through that we can just strengthen the efforts that we have across Africa. Yeah. So thank you for that. I'd also like to thank the leadership of Morocco Sim just for having me this evening. I think I do not take it for granted. You could have had anyone. So I really just appreciate the time and the audience taking time out of their busy days to listen. So yeah, so as you've done the introduction, I'm Marvin Jansen from Cape Town, South Africa. Currently a very cold Cape Town. We're currently in the heart of winter, but as I said, I'm very privileged to be here this evening. So I'm going to share my screen, but please feel free to raise your hand or ask a question if you feel like that something is not clear. And yeah, I welcome also some questions afterwards. Let me just share my screen. Okay. So yeah, great introduction. When I thought about this title, it was a title that I also spoke about at the ASP conference last year. And it's something that has really shaped the way that I view healthcare, and more in particular, healthcare simulation, because I think it's a powerful way, and it's not something that's foreign to us as Africans. There will be versions of Ubuntu in every, if not most, if not every culture across the continent. So I think oftentimes we are pushed to adopt ways and methods that is maybe not as familiar to us, where we've got some strong cultures and traditions that are like deeply ingrained into who we are. So Let me just speak around and say it's not going to be anything new for us as Africans, but I just want us to double down on it and really use this lessons that's been shared from through generations and generations to strengthen the healthcare simulation and the healthcare and patient safety. Okay, there we go. So I firmly believe that context matters. Whenever we're looking at anything, we need to see what is the context surrounding that thing. So I come from South Africa, a beautiful country that I love and that I'm very passionate about. But because of our past, we've got some unique challenges that we need to address and face head on if we want to really make any real concerted effort within patient safety. One of that is that South Africa is a country that has experienced huge inequity. In fact, and if you look at the Gini report, it shows that South Africa ranks the most unequal society. And I think this is a good picture that depicts that. So here we have a luscious green golf course, and just right next to that, we'll have what we call an informal settlement. And because of that, I mean, this is just an example of that, but of course, it extends through every facet, and in particular, the healthcare system. So you have a situation where you essentially have two healthcare systems that are working in parallel. You've got the private sector, and then you have the public sector. And that presents some unique challenges for us. So I just want to position the conversation and what I'm talking about within that. Is to say I'm in a situation, I'm in a context where we have a system where there's huge inequity that extends across all facets of life, but also within healthcare. Then, if I want to bring it a little bit closer to home, many years ago, I was involved in a motor vehicle accident. And by the grace of God, I survived. But it was not without its challenges. So through the course of that motor vehicle accident, I sustained severe injuries, which included bilateral flail chest, bilateral femur fractures. And basically that exposed me to the healthcare system in a very intimate way. So I was bedridden for 9 months, and after that had to undertake a long period of rehabilitation, had to learn how to walk again, etc. And while that was a very challenging and very difficult time, it really gave me some first-hand experience of what the healthcare system looked like. And during that stage, I was exposed to the public healthcare system. And while there was lots of challenges and lots of austerities and lack, what I was so amazed by was the passion of the healthcare system and the healthcare practitioners, who, despite the challenges that they faced, was still able to have an impact on the lives of a patient. So for that, I'm eternally grateful for. And it's also really shaped the way that I view the healthcare system and how I view education and particularly healthcare simulation, and how we can have a positive impact on the heroes essentially within the healthcare system. So please keep that in mind when I speak around the topic today, is that that's the context in which I find myself, having been at the receiving end of a healthcare system which oftentimes was very broken, but yet was able to have a meaningful and impactful impact on my life. And then, of course, if you look at Africa, we've got some significant challenges that we face. So I want to speak around one. There are many within the healthcare system, but of course, the one that I want to speak around is the workforce gap. So the World Health Organization says the African region is projected to face a shortage of approximately 5.85 million healthcare workers by 2030. 2030 is not that far. And approximately 87% of that projected shortage involves doctors, nurses, midwives, pharmacists, and other core health professionals. So, I mean, that's quite a bleak picture that we're looking at. There's going to be a significant and massive gap and lack of healthcare workers in the very near future. And sub-Saharan Africa had approximately 0.2 physicians per 1,000 people in 2022. And this is compared to about 3.8 per 1,000 in high-income countries. That means that high-income countries had roughly 19 times as many doctors per population. So this, again, just paints a picture of the challenges that we face. And you might say, okay, what are we talking about? I'm not talking, we're supposed to be speaking about healthcare simulation. I believe that healthcare simulation is a tool, but the ultimate goal is to impact patient safety. So that's why I'm saying that this is the context in which we're finding ourselves. So Africa doesn't simply need more healthcare workers. It needs more health workers who are appropriately educated, equitably distributed, supported, employed, and retained. Because we are well aware of the challenges that we're facing. Oftentimes, we're training up skilled healthcare workers, and then essentially we have the brain drain to other countries, etc. So it's lots of challenges that we face as a continent. And I believe that we have to look at this through a different lens. Because if you're going to try and simply just approach this from a point of view where it's simply just an HR challenge, I feel that there's going to be some challenges in that. So we have to look at this through a different lens. So this is what I want to present. I want to present this idea of Ubuntu. So Ubuntu is not new, as I said, across the continent. It's a collection of values and practices that people of Africa or African origin view as making people authentic human beings. While there's nuances in these values and practices across different ethnic groups, they all point to one thing. An authentic individual human being is part of a larger and more significant relational, communal, societal, environmental, and spiritual world. So, simply put, that's a mouthful and it says a lot of things. But simply put, I say, I am because we are. So, we do not exist on our own. We just weren't simply just placed there, but we fit into the bigger picture. And I believe if we view healthcare through that lens and healthcare simulation through that lens, that it will only be beneficial for us. So there's a few principles that generally, as I said, there's adaptations and versions of Ubuntu across the continent. But generally, we've got four principles that I'd like to speak on. Number one is that this idea of interdependence. And we need each other. It's not good enough for you, whether you as an individual, you're only going to upskill yourself and make sure that you are the best, because we know that you're going to essentially have to fit into a healthcare system that's very complex. And oftentimes, even if you are highly skilled and highly educated, it's not enough to ensure that patient safety at the end of it is adequate. So it's interdependence. That's only at the visual level. If we look at the system level, it's even more interdependent, that we cannot have one system that is functioning and going on all cylinders, but the rest of the systems is not adequate. Because at the end of the day, holistically, the system is going to be inadequate. Compassion and empathy. We have to care for each other. It's not good enough that we operate within a way and only have to think through a lens of management, maybe, or as I said, HR, etc. But there's no real compassion and empathy for each other. We're not thinking about, yes, even though this might not be to my benefit only, it's going to benefit the greater good. Respect and dignity. Again, as I said, this is nothing new. This is not unique to any one culture, and it's really ingrained into various cultures across Africa and across the world. But oftentimes, we are almost made to believe that these things are things that we have to put aside when we enter the work environment, and it's only something that we can put on back when we exit that healthcare system again. But I want to suggest that that's not the way to approach it. Is that we need to embrace these principles, which is such a big part of who we are as human beings. And then the last one would be community and solidarity. We are not an individual. You're not an island on your own, and we are connected. And I think if we're going to embrace that idea of community and solidarity, it's only going to make us stronger as a whole. So essentially, what am I saying? I believe that all we have to view through is that we are connected. We're not operating as an individual, particularly in something as complex as a healthcare system. Anyone that has spent any significant amount of time in a healthcare system knows that it's a complex matter. Something as simple as ordering a new pen, you will realize how complex a healthcare system is. So to think that you can come in there and as an individual and only think about what's going to improve yourself or what's going to improve your unit, I think it's very naive. And if we view the healthcare system as a connected living, as a connective entity, it's only going to strengthen us as well. So I like to think of this as healthcare simulation. I think we're in a very unique position in that oftentimes um, I believe that we can be seen as water. What is water? Water is essentially known as the universal solvent. And what it means by that is that oftentimes many other things can come in there and they can coexist. So we know that within healthcare systems, we have lots of silos that operate. Within disciplines, we'll have silos. In between disciplines, we'll have silos. In between professions, we'll have different silos that prevent them from working together, that prevent them to talking to each other, that prevent them to coming around the same table. So I think that healthcare simulation possesses a unique ability to act as the water that brings all of these seemingly different things and people together so that they can coexist and see that they actually are only strengthened if they're working together. But there is a risk that I want to speak about, though. Is that as with any field, there is this knowledge life cycle where a field that is new will go through these various phases. And as it goes through these phases, it will, like with anything, it will pick up certain characteristics, it will develop, etc. And I believe that if we're not going to be careful as the field of healthcare simulation, that there's some inherent risk that exist and that will ultimately weaken us as a field. So this is just a generic life cycle of any field that I want to speak about. And the first phase would be the pioneering phase. This is generally in the beginning where it's a little bit wild and it's a bit messy, and problems are ill-defined and methods are borrowed from elsewhere, and everyone is really considered the generalist. So this is like the beginning stages of healthcare simulation, where we weren't really sure who we are as a field. People were oftentimes coming from other fields and having to come in there and being really a generalist in the way that they would solve problems. Thereafter, the next phase is the paradigm setting. And here we develop a little bit more and we develop some tools that is uniquely ours. So important. And there would be some methods and exemplars that stabilize what counts as a good problem and a valid solution. So we're really trying to develop a bit of an identity as who we are as a field. And that's positive. I mean, so of course now we're moving a little bit away from this idea of a generalist, and we go into the third stage where we have like specialization now. And specialization is as this field continues to develop from the pioneering phase, then to the paradigm setting phase, to the specialization. Now we have people that now say that I'm not a generalist anymore and I'm going to look at certain problems. For example, you might be a technician, simulation technician. Other people might say that they're only specializing in interprofessional education. Other people might say that they're only specializing in VR or et cetera, et cetera, et cetera. And yeah, this should be familiar as to where we currently are as a field in healthcare simulation. And these things aren't inherently bad. They're part of the natural life cycle of a knowledge field. But what I do want to say is that then there's another one
Ayla, are you here? So I think Marvin Johnson just lost his connectivity. Let me just text him to see what's going on.
Apologies. Can you hear me?
Yes, yes.
Oh, I don't know where I lost you guys. But just remind me, where did I lose you?
Just reach.
Specialization.
Yes.
Quantification.
Specialization.
Specialization. Okay, perfect. Okay, let me just share again and then we'll go there. Okay, can you see my screen?
Yeah.
Okay, perfect. Um, okay, yeah. So then the next phase is specialization, and during specialization, again, not inherently bad, but now we find that people are moving even further away from that generalist approach, and now they develop certain fields of specialization. So, someone in our field that might be someone is particularly looking at VR, or someone's looking at interprofessional education as a specialized field, and that's essentially the boundaries that they've put up for themselves. Or someone might be looking at um, what are some of the other ones? IPE, etc. So these things aren't inherently bad, but this is just the natural, the natural life cycle of a new field. And then, and then the last phase is ossification. It's like the ossification phase is that if we're not going to be careful, then there's a risk of this ossification happening. And what does this mean is that we as a field then lose that inherent ability of flexibility, where people then, if they come to us from the greater healthcare system with a particular problem, we've become so specialized that we say that, no, it doesn't fit into this, it doesn't fit into that, we're not able to help. And I think inherently that's not to the benefit of us as a field, because essentially what happens is that we then become not water. We lose this inherent ability that we have in the early days of healthcare simulation, where we were really able to come into this complex healthcare system and be able to act as a universal solvent. But because of the field has become so specialized now, if we are not going to be careful, we might have this ossification risk. So, what is possible if we embrace the sense of Ubuntu, if we embrace the sense of that we're essentially a universal solvent for a very complex healthcare system? This is an article that I'm sure everyone has seen. It's the Safer Births study that was recently published. And it essentially looked at very low technology simulation interventions and the effect that it can have within a healthcare system. And of course, I've left the study there, so please have a look. But essentially, this study showed a reduction of about 75% in maternal deaths and 40% in early newborn deaths after implementation of the Safer Births Bundle of Care program. And that's currently taking place in over 150 healthcare facilities in Tanzania and has now been expanded to other parts of the continent, including Nairobi, Nigeria, and many more. So, what can we do if we're saying that we're going to embrace this idea of Ubuntu? What does it look like in practical terms? Number one, keeping with those values, we need to say that we need to avoid tokenism at all costs. What do I mean by tokenism? Tokenism is this idea that we bring along people simply just to tick the box. We bring on someone from a maybe less developed environment than us, or you bring on someone from a different hospital group, but simply just to tick the box. You don't actually value that person bringing the different viewpoint and the diversity into the project, and you're simply just using it as a token to maybe attract funding, etc. This is not embracing Ubuntu. Secondly, we cannot be extractive. What do we mean by that? Is that we cannot say that we're simply just going to go into this environment and do research or do collaboration in that place, but just take essentially that population that's there, whether that's a healthcare system, whether that's a different hospital, etc., is really not benefiting from that at all. And it's simply just a situation where we're extracting from that and not adding to that. We have to be sensitive to the context. As I started off this morning, as I started off this talk, context matters. We always have to be very sensitive about the context in which we find ourselves. And we have to think long term. Sometimes there's this tendency to think only short term, but that's not going to benefit the greater good. And oftentimes, short-term collaborations is going to prioritize short-term gains at the risk of long-term benefits. And we have to promote researcher flow in both directions. This is now in the context of doing research in contexts that are more than just your own. So I'd like to present something that I'm very, very, very passionate about, the African Simulation Network. And the African Simulation Network was really something that was birthed out of this concept of Ubuntu. What I found is that when I entered this amazing world of healthcare simulation, there was I was lost in it. And I was lost in the possibility of what is possible in healthcare simulation. But then as soon as you then consult the literature, you will find that there's very little literature from Africa. And that was, of course, a little bit concerning for me to say that surely it's not because we're not doing anything worth sharing. And as I then started engaging with various amazing people across the continent, that was just really reiterated to me. It's not they're doing amazing things all across the continent, but for whatever reason, we are not sharing all of these amazing things to the rest of the world. And of course, that is very concerning because that might give the narrative that we're not doing anything worth sharing, which is not the case. So I started this very informal initiative called the African Simulation Network. And through the grace of God, many people came alongside me to say that they believe in this. And the beginning of this year, it grew and we became a continental-wide society for simulation. But as I said, Ubuntu just reiterates this idea as that no man is an island. So African simulation is definitely not my thing. It's something that I might have done the initial work to get it going, but since then it's just been taken up by amazing people who's really bought into the idea and is taking it forward. So just quickly, I want to just go through some of the executive board. Some of the faces will be very familiar to you. And then some of our regional leads and our portfolio needs. And I really want to welcome and invite anyone that wants to come alongside and really work towards the shared goal of showcasing simulation excellence across the continent with us. So currently I'm the president, and then Prof. Maawi is the vice president, Dr. Durich is the secretary general, and then Mrs. Parker Ross is the treasurer. Then we've got, because Africa is such a diverse, beautiful, beautiful continent, I think it would be very naive of us to think that we would be able to set the agenda for a continent that is so huge and beautiful and diverse. So we've appointed some regional leads which are really amazing individuals across the continent who are really spearheading simulation excellence across the continent. So we've got Dr. Awu, who's covering Western Africa, Miss Suji, which is covering Southern Africa, Dr. Daiki, who's covering Northern Africa, Dr. Ataki, which is covering Central Africa, and Dr. Masimbi, which is covering Eastern Africa. And then for now, we have two portfolios that we're quite passionate about. And of course, these will expand into many more portfolios. Currently, we have Dr. Santorino, which is our research lead, and then Dr. Manipeni and Dr. Hussein, which is our simulation guidelines leads. And for now, we thought these ones are quite important because we do not have a massive team yet, and we want to really be impactful. So one of the areas that we really want to be impactful is through research and really showing impact or the impact that healthcare simulation has across the healthcare system. And number two, we want to really tackle this idea of what is guidelines, oftentimes known as best practice guidelines. And what does that look like within the African continent? Because I think there's this tendency oftentimes to say, let's just adopt guidelines from a different context. And many of that might be applicable to our context. But let's look at it from a first principles approach and see what does simulation guidelines for Africa look like. So I want to end off simply by saying a very, very, very well-known African proverb, but I think it really encapsulates what Ubuntu stands for. And that is that if you want to go fast, you go alone. If you want to go far, you go together. And then please reach out to me via email or via WhatsApp. And I'd love to continue the conversation and I welcome questions. Thank you.
Thank you very much, Marvin. As always, fantastic presentation. I had the pleasure of hearing it first in ASPE opening day, and I was like, we're doing it for Africa. We should also get engaged into with the African audience. So, and I'm very, very, very happy to see a lot of familiar faces and very interesting audience. So let's open the Q&A and start asking. And before that, let me just introduce our president who just got connected for us because he had a parallel scheduling at the same time. Professor Mohawi, the floor is yours.
Marvin. Good to see you, Marvin. So sorry for the delay. I was running a masterclass, summer school of medical education. We have just finished. Thank you so much for attending this webinar. And as you know, Morocco sim is yours also. Thank you. Thank you, Marvin.
Thank you, Prof. Always good to see you.
Okay, go ahead for the discussion. Okay.
So we have Edgar saying greetings from Mexico. Hi, Edgar. Congratulations on this fantastic initiative. You can count on the full support of SOMSIC, the Sociedad Mexicana de Simulación en Ciencias de la Salud. I hope I didn't butcher this Spanish. We believe that Latam and Africa share far more similarities than differences. Definitely. We definitely agree. Please all of you feel free to activate your mics and cameras and just say hi and take part of the conversation. Let's connect. Ubuntu.
Greetings, Edgar. Always good to see you. And as you said, I do believe that we've got much more similarities than differences, and we'll only be stronger if we work together.
Yeah. I also see my professor, Professor Ahmed Ghassal Adib. I hope you're doing well. And shall we start the Q&As with you?
Evening, everyone. My name is Asma Salim. I'm from Saudi Arabia, John Hopkins Aramco Healthcare. Originally, I'm Jordanian. I would like to ask about the Arab Sim Society, the new one.
Yes. So we're very, very proud of the Arab Sim Society that got recently officially opened. I have two people that are very, very qualified to talk about it, which are its president and founding member, Professor Mohammed Mohawi, and I also seen Tahani as a vice president. So after the Shine webinar, you can contact them and ask any question that you would like about the Arab Simulation Network.
Okay, very good. Thank you.
Yeah. I also see my professor, Professor Ahmed Ghassal Adib. I hope you're doing well. And shall we start the Q&As with you?
Yes.
I do see a question from Lance Bailey. How is Simulation in Africa primarily funded? Obviously, there are lots of different countries and stages, but overall, is funding coming from nation states, NGOs, public health, and universities? Yeah, I think the answer would be all of the above. I really think that it's first to see my context is that often I'm within university structures primarily, and that is it's funded through university and the fees and government funding that comes from that. But I've encountered many people, and oftentimes they would be through NGOs, etc. So I think that's one of the challenges that we currently facing as Africans, is that the funding streams are so diverse, and as such, it's difficult to come up with a strategy that's going to be applicable to everyone. It's really just to be on a case by case. Yeah. So yeah.
Mohammed, please activate your mic.
I was saying, bonsoir, Denis. He said, thank you very much for your presentation. It links pedagogy to distributive justice, and simulation may be the tool. We couldn't agree more.
Yeah. Thank you for that. As I said, I think, as I said, and I hope it came through the presentation, I believe is that Ubuntu, which is not new to any of us, I think it's something that's ingrained into many cultures, is a powerful way to just view the role that healthcare simulation can play within healthcare systems. But as I said, I think that oftentimes there is this tendency to think that we have to leave ourselves at the door when we enter our workplaces, and I think that's not going to be beneficial to anyone. Yeah.
The next comment is from Lance, and it's combining both of you, Marvin and Professor Mohawi. Are there plans for an ASN conference and an Arab scene conference? We're excited to support both.
Yeah, no, definitely. I think if I can speak for the African Simulation Network, yes, definitely. There are definite plans for a conference. Of course, what we're just very careful of is that we want to ensure that whatever structure, whatever events that we do holds true to our core values, and one of them being inclusivity. So I think we really want to see how do we tackle this idea of a conference, but keep hold true to our core values of inclusivity. Because oftentimes, with the best of intention, these things become very exclusionary and can be out of reach of many of our supporters across the continent. So yeah, so we really want to say is that let's not rush into these things and just perpetuate some of the challenges that conferences and present, and how do we attack this thing using our innovations and the values that we hold through as Africans. Yeah.
Perfect. I think Professor Mohawi answered in comments. He said for sure. He doesn't want to ruin the surprise, I guess.
No, it's okay for you, Lance Bailey. Lance Bailey, for sure, we'll be back to you shortly, and you will be supporting us as you did for Morocco Sim, inshallah. We are more than sure, and so far we will invite you to be our official media partner, inshallah. Okay.
Yes.
Maybe I say something. I'm very pleased. I want to congratulate Marvin for his talk and for choosing this thematic, Ubuntu. Ubuntu is a concept, is a very important concept, African concept, rooted concept. I met him 2 weeks ago in Addis Ababa, and it was an occasion for deans and leaders in education through Africa to build things for the future, and especially simulation was of the most important thematics. And in Africa, we have a background, big continent with difficulties, and it was said inequities. Like Denis wrote, simulation is based on the basic assumption that is we believe that everyone is intelligent, want to care, want to improve, is something very important. Through simulation, we can build these interactions, this equity, this bring in education and patient safety to our citizens through our different countries. So it's very important to share and to create spaces like this for sharing experiences and growing networks, even in African networks or Arabic network. And I believe that through this network, we can promote especially training the trainers. Because sure, Lance is building a network through the world, and he talked about funding, but for me, it's not funding the issue. We can do simulation without big money, without mannequins. We can build many things. Especially, we have to build this network for educating the educators and training the trainers. Sorry to be long, but I wanted to share this because training the trainers is Ubuntu.
Yeah. No, thank you, Prof. Adib. I mean, and yeah, lovely to see you again, and I couldn't agree more. And I think that's why I'm so passionate about networks, because oftentimes we might think that everyone knows what healthcare simulation, but that's not the case. I mean, we just saw it again in others, is that for many people it's still a very foreign concept. So the responsibility is on us as champions. When I say us, it's all of us in this call and everyone that's involved in simulation to really educate people of what it is and what the possibilities are. And I think one of the bigger barriers that we have is that people do see simulation as a technology and not a pedagogy. So we need to kind of speak with one voice to say that this is a pedagogy. If we're going to focus on equipment and technology, you're really limiting it. We have to focus on faculty development because that's really the most valuable resource that we have on the continent. That we've got amazing people that have years of experience of working within austerity and working within environments where we didn't have enough. And I think that's also the big contribution that we could make to the rest of the world who are now facing situations where they're facing austerity and they're facing challenges. And we can say, but we've been doing this for years and been getting good outcomes. So I think we shouldn't feel that we are inferior as the African continent, but I think we've got a very unique and very powerful contribution that we could make to the rest of the world and to the rest of the simulation literature out there.
Yes, thank you for this. It's as you mentioned it follows up what David Gaba said with simulation is technique and technology. We're projecting it into the pedagogy world, and I know the subject is so interesting. We're all trying to connect, but unfortunately we have a schedule that we need to respect. So for the next 5 minutes, I would love to ask for Professor Mohawi to activate his camera and mic, and we'll be very, very proud to officially sign the first one of the first ASN affiliation, the first in Africa, between the African Simulation Network, represented by its president, Professor Dr. Marvin Jansen, and the Morocco SIM, the Moroccan Society for Simulation and Healthcare, represented by its president, Professor Mohamed Mohawi. So I'll ask Ala to share the agreement, and I'll ask everybody to send applauses on the chat.
And maybe we can make a virtual shake of the hands. Thank you. Officially signed.
Thank you. I think this is long overdue. I think it's we've been working together for so long, but I think it's nice to make it official. Yeah, and I'm just so excited to see how this collaboration is going to grow and strengthen us across the continent. Yeah.
Once again, I assure you, Marvin, Morocco SIM is yours. So go ahead.
Thank
Really.
you, bro.
Yes, we definitely, I think you can definitely feel it. We love working all together. and get connected and get Ubuntu. And we need to share this value and to showcase it more so that everybody can adhere to it and see the amazing work that we're doing in Africa. I
Exactly.
also want to give a shout out to the all of the board of directors of Morocco of the African Simulation Network. I've seen that the representative from North Africa is here, Mesa. Mesa, would you like to say hello?
Mesa, okay.
You
Hey,
see me? Hello.
Yeah.
Good evening, everyone.
Mesa.
Good evening. Is I can't find the other one in the audience. Is Dr. U? Any if
No,
you're
no, no,
please,
I don't say it. Yeah.
I don't think they made it, but if you're there, please activate your camera and say hi. It takes a lot of people to make something this big works, and we're definitely very proud and happy and lucky to have you guys to count on. And next, I'd like to say a big thank you to Marvin Johnson. Thank you for the always making the time for Morocco Sim, and thank you for the amazing work you've been doing for years into the African Simulation Network. Certainly, the African Simulation Network, we officially announced it in the HGIC in Rabat, but Marvin has been doing a lot of amazing steps for the African Simulation Network for more than 4 or 5 years. So thank you for bringing us all to your journey. We're definitely here to help. And at the same time, thank you for the audience. I would love to put the projection to to what's coming next. So the next Shine webinar will be taking place in October, and I'm lucky to have Edgar with us because it's gonna be a Latino themed the Shine webinar with our future two societies that we're very proudly affiliated with. SOMSIX representing Mexico, and at the same time, Betty representing Ecuador. So we jumping from Africa to Latin America to doing a tour of the world so that we bring everything from around the world to Morocco and to Africa. So thank you, Edgar. If you're here, would you like to say a word? I don't know if you're free.
I go. I'm not sure if you can hear me.
We can definitely.
Okay, thank you. I had some issues, but I'm sorry I can't turn on the camera, but I just want to say thank you very much for this invitation. It will be an honor and it will be great to present what we are doing in Mexico and Latin America and to find the way that we can still work together because I feel really inspired hearing all of you and knowing that a lot of people around the world are working so hard in order to improve what we are doing in simulation and doing amazing things in their countries. So I hope that this could build a new bridge between Africa and Latin America, and to show the world that maybe we speak different languages, maybe we have little difference, but we have a lot of things in common, more things in common that our differences. So thank you very much, and I'll be preparing for my conference. Thank you very much, Mohammed.
You're more than welcome, and thank you for your kindness for those past days. And last but not least, Ali, could you please share the screen? We as you know, the webinars of Morocco Sim, the Shine webinar takes place every month, but we skipped September because in September we got our breaking news by PS. So it's the Patient Safety International E-Conference on Training and Simulation for Patient Safety 2026 for all our affiliate societies. Please mark the calendar. It's on the 19th of September 2026. It's basically an HGIC in a day virtually. So it will you'll get to put your foot on what's amazing happening around the world and how we're pushing forward to help the patient safety community and the patient safety in the world. Thank you very much. I was very, very pleased to host you. I'm Dr. Darwish Mohammed, and I'll leave the final word to any final word for Marvin before we leave them.
Yeah, just thank you again for everyone for coming. I mean, as I said, please feel free to reach out. I also want to acknowledge Professor Rebecca Gray, who's on the call, who has been, working alongside me from the right at the beginning in terms of when African simulation was just a thought. So thank you for that, Prof. And again, as I said, anyone that wants to walk alongside us, this African Simulation Network is not mine or any one of the executive. We welcome you. And I think we've got a responsibility to our patients to ensure that our healthcare professionals and our healthcare systems are operating at the best that it can be. So thank you.
Thank you very much, Professor Mohawi. The closing word.
I will be very short. I wanna Before all, thank you, Derwish Mohammed, for the excellent job you are doing for us. As you know, I appreciate you a lot. You are a very important guy inside the board, and I cannot be more proud of you. Thank you so much, Derwish Mohammed. And I'm sure that Morocco Semi future will be between good hands. Thank you so much. Thank you, everyone. Thank you, Marvin. Astonishing, as usual. Thank you for the audience. Thank you, Dodo, for your attendees. And see you, inshallah, September for our third edition on on the International E-Conference on training and simulation for patient safety, and the very exciting and amazing webinar of October. I'm talking about the Latinos webinar with the participation of the Mexico and Ecuador. So looking forward to seeing you for our upcoming events, and goodbye.
Bye bye, everyone.
Bye.
Thank you.